My name is Alaa Gabi. I did my internal medicine and cardiology training at Marshall University. Then I did my interventional cardiology training at Allegheny General Hospital in Pittsburgh. Interventional cardiology, we get trained to treat cardiac and vascular disease. I mean by cardiac, by treating blockages in the heart vessels, treating valve disease. Mainly I was trained to treat aortic valve disease like aortic stenosis by procedure called TAVR, or closing holes in the heart that can be related to strokes like ASDs and PFOs. Also I was trained to treat vascular disease. I mean arterial and venous disease. Arterial, which means blockages in the arteries of the extremities, in the upper and lower extremities that can cause ischemia or pain. We train to treat this with medical management, or like by pills, or treat them by interventions. Also, I was trained to treat venous disease like venous insufficiency or venous blockages. Treat them also by medicine or interventions. During my fellowship, I feel part of my training was that I was trained by the patients themselves not to give up and to be persistent. We had a lot of cases who was like in emergency and their life was in danger. We could help them and make them make it actually through this, and that by itself trained us to be persistent and never give up in our care. I would like to get very close to the patient from the first visit, know how he thinks and what his expectation from the treatment plan. Also, I would like to get him engaged in the treatment plan, so we can both actually be on the same page. I would like every patient to know that I'm reachable. I would like him to contact me anytime actually he feels he has any question. I would like the patient to be consider me as a friend more than a physician. My favorite part of being a doctor, especially a cardiologist, is to be with a patient during emergency situation and be the helper, or try to be the helper in these conditions. Helping a patient during emergency and see the outcome immediately, actually, with saving some lives or taking care of their pain. Seeing the outcome on the same day as a cardiologist or next day make me feel actually very happy and satisfied. So we perform heart procedures and vascular procedures. Heart procedures, either opening arteries that get blocked in the heart, or doing treatment of aortic stenosis by a balloon valvuloplasty, which is just like balloon to temporarily open that valve, or replacing the valve through the catheter, which with a procedure called TAVR. Also, we do a procedure to close the holes in the heart that can be related to stroke. That is called PFO and ASD closure devices. Also, we do vascular procedures, and the arteries we do opening blockages that can relate to pain or ischemia. Also, we do procedure to help with the vein disease, like vein blockages that can cause fluid to accumulate in the lower extremities, or vein disease like varicose veins, that dilated veins in the lower extremities that can cause pain and skin changes. We treat that with a vein ablation procedure. Holes, PFO or ASDs, are congenital holes in the heart, can be related to strokes or shortness of breath due to changes in the pressure in the heart. The treatment for these sometimes can be a closure device for these PFO or ASD. The way we detect these PFOs by doing echocardiogram and a bubble study is that we inject bubbles on the right side, and we're looking for these bubbles to move from the right side to the left side. It's just part of the workup for a stroke. We don't find it in all patients who has a stroke, because there's other sources of stroke, like building plaques in the arteries in the neck, or some people who has AFib, like irregularity in their heart rhythm. These people are also at risk of strokes. With the stroke, most of the time, actually, the reason for strokes are plaque buildup in the arteries, goes to the brain, or could be a clot formed in the heart and went up there. In 25% of the cases, we couldn't find the source of that stroke. That's what we call cryptogenic stroke. And those people, actually, we look for genetic disorders or hereditary tendency to form clots, or we look for holes in the heart like PFO. When a patient comes with a stroke, part of the workup is to look at his heart. If he has an irregular rhythm, that can be a source of forming clots that can goes up to the brain. Looking for PFO, which is a hole in the upper part of the heart, can be related to stroke, especially in young population. Also looking for other risk factors, like if he has a vascular disease, or he's having blockages in his neck arteries, or forming plaque that can get dislodged and goes up to his brain. So looking for PFO is very important, especially in young population. In my training experience, we saw a lot of young patients who comes with multiple strokes, and we find that they have PFO, and studies actually showed that closing PFOs in these population can help prevent strokes from happening in the future.